Emily, thanks for joining us here at Track the Vax. I want to talk to you today about vaccine hesitancy. It's a big issue, one that you face and kind of deal with every day, not just at your job, but on social media.
It's kind of taking over right now for sure. And it's going to be, I think, coming up here, the deciding factor in, can we get past this pandemic or not? So super important.
What are you hearing when you're at work versus when you're online?
Yeah, well, I've been doing a lot of working at vaccine clinics. So at actual vaccine clinics, everyone's really excited. I mean, you wouldn't be there if you weren't. Nurses and doctors certainly wouldn't show up to vaccinate if we weren't excited about it, and most of us are. And at this point, demand is still outpacing supply. So the people who show up to get vaccinated are also very excited. So, there's a lot of people, there's tears, happy tears, there's, a lot of joy and excitement. And then I kind of get online and there's all this fear and confusion and misinformation. And yeah, it's two different worlds for sure.
What do you say to those that reach out to you online? It's kind of a weird role you took on, this like med influencer personality, your handle, Two Dusty Travelers.
No, it's not. I mean, my husband and I have this account because it was our travel account and we used to post travel pictures. And I will do again when I can travel again, kind of disaster response nursing and humanitarian work abroad. And so, I posted a lot about that, which is how I got into kind of doing this. I treated the first COVID patient in the U.S. because we had a biocontainment team at our hospital. So we got that first patient. And I have some experience with Ebola as well. So I kind of fell into posting about all of this. And then it just took off because I think there was just this, gaping black hole void of information throughout the pandemic, and people didn't know where to turn.
That hole has kind of shrunk since we're now more than a year into it. But when it comes to vaccines, there are still so many questions and many that lead to that hesitancy towards it. What do you find are some of the biggest causes when it comes to hesitancy?
It's really across the board. And sometimes it feels like I'm playing whack-a-mole with like conspiracy theories. And as soon as, me and my other kind of medfluencers, as you say, deal with one, another one pops up and we're like, where did this even come from? A lot of it is just purely rumor that takes off. But I think some of the big ones are, that these vaccines haven't been tested for long enough and that there's not enough long-term data, which, really isn't a concern. I've discussed that ad nauseum. The one that just won't die is people being worried about infertility from the vaccines, which is based on nothing. It's not true. It's, there's no science to suggest that, but it just, it got out there and now you can't take it back. But there's also, very well-founded hesitancy among communities of color that have very, legitimate reasons to be mistrustful of, healthcare in general. There's a whole spectrum of reasons.
I want to jump into some of those a little more deeply, but before we get there, hesitancy is kind of an interesting question, right? Because when the vaccines first rolled out, there was a huge amount of hesitancy among all cohorts of people. As we've seen more people get the vaccine, that has come down a little bit. But is it also kind of that question of when they get the vaccine available to them, how will they actually act versus a hypothetical?
I think it'll be interesting to see what happens, like you say, once it is available to everyone, easily available. I don't know if there's a difference between what people say they'll do right now when it's like not available to them anyway, and what will happen when they could just, bop down to the pharmacy and get it. But yeah, I also think, you're reminding me from what you said, I think there's a huge difference. I think the vast majority of people are truly vaccine hesitant. They're just not sure. And questions are great. Healthy skepticism is great. That's fine. And there's a small group of very loud people who are truly more like anti-vax, that there's nothing you could say or do. Yeah. And when I say people anti-vaxxers this and anti-vaxxers, some people get offended, well, I'm not sure if I want the vaccine. And I'm not. And I'm like, no, I'm not calling you anti-vax. I'm saying these organized groups of people that are purposefully spreading misinformation. They're in my DMs calling me a Nazi and, like telling me that I'm killing children.
wow.
Like there's a very small, very loud group of people that are doing that. And then a huge group.
And those are people, though, that are against all vaccines.
Yeah, especially these ones. But then most people are just like, this is new.
Especially these.
It's been a very confusing year. And that's a reasonable response to all of this,
What do you say to them? Those that are just a little hesitant, cautious.
It's very labor intensive. Because you really have to tease out what is your specific concern, because if it's, concerns based on, historical issues with their specific like communities of color, like that's one response. If it's, I'm worried it's going to cause infertility, it's another. You just really have to tease out what their specific concern is. And, I've been doing my very best to answer as much as I can, broadly for everyone, and hope people I'm like, check the highlights. I've answered all of these questions, they're there,
they're right there.
But I get it. It's been a very confusing year, and science changes too. So what I told someone in December about like, oh, we don't have data on this yet. Now we have lots more data, which is great, but some folks kind of glommed onto back in December, well, we don't have any data about whether the vaccines prevent transmission. So they said, well, why get a vaccine anyway if it doesn't prevent me from giving it to someone else? And they kind of misinterpreted that as, well, I'm saying we don't know yet. And they're hearing, well, it doesn't prevent transmission, so there's no point. And now it's March and we're saying, well, now we know it does. And that change is very difficult for people.
Yeah, that's an interesting space, though, that you're playing in, right? Because Instagram, instant, people want to see things immediately. We're very much a culture of instant gratification. And in science, it doesn't work that way. How do you balance that?
To me, the most important thing, and what I feel so honored that people have trusted me over the past year, because I didn't ask for this, it just kind of happened. The most important thing for me is that my followers trust me. And so I'm never going to say something that I don't know to be true just to give people the answer that they want to hear. So, if we don't have full clinical trial data on pregnant people yet, that's what I'm going to say to you. I'm going to tell you the pros and cons and what I would do. But I'm not going to, tell you data that we don't have. And that's all you can really do. And I think that's honestly what sets us apart from some people that are posting misinformation that we're willing to say, I don't know, we're still waiting on the data on that, whereas I think folks that are, very deeply anti-vax and posting misinformation, et cetera, it's like they know everything already with information that you couldn't possibly know yet, and they're like, oh, we're certain this is going to hurt you later in life. I'm like, how could you know,
Yeah, to wait until at least a little bit later in life, I guess. Well, it's interesting timing right now because the administration just announced a huge ad buy to try and impact some of this vaccine hesitancy. They have 270 plus groups from NASCAR to the Catholic Health Association. Part of this is essentially an ad blitz by the administration to encourage people to get vaccines who might not want it. Will something like that even help when it comes to this subset of the population that have these concerns?
I really don't know. I think it's a double-edged sword. I mean, we certainly have to try. I've been very upset, with the previous administration that they were not doing any science communication or doing harmful anti-science communication, So we certainly have to try, but I think there is also a subset of the population that has become very mistrustful of anything the government says, and kind of that might almost make it worse, but we certainly have to try,
And you mentioned that deep skepticism, especially among different population groups. We know that the vaccine is considered. We know that there's big vaccine hesitancy among Black people, Latinos, Republicans, white evangelicals. That seems like it's, almost all encompassing within every subset of the population. There are those that are hesitant. So how do you reach those individual subsets of the population? Is it through people like yourself who are there on the ground? Is it through the mass media? I mean, what are you hearing when it comes to your followers?
I think it really helps to have someone reach out to these communities that's from those communities. I mean, I'm fairly openly liberal on my Instagram, and so I don't think a conservative Republican is particularly interested in my take on like why Republicans aren't getting vaccinated, and that's fine, hopefully there are influencers that are addressing that for their own communities, but same thing with communities of color. Like I'm not the person to tell Black communities why they should trust the healthcare system after everything we've done to them, but there are plenty of people doing that. I mean, Kizzy Corbett, who helped, develop the Moderna vaccine, has been like out and talking about this so much and making such a huge difference. And I think that's the way we do this.
What role do you see social influencers like yourself playing in this sphere?
Yeah, I think we have come to a point where to be silent on a lot of different issues, not just vaccines, but this past year, there have been social movements.
And when you say we, you mean
I think influencers in general.
Medical?
I think if you are on Instagram and you have a large following, you have a responsibility to speak up about things that matter. Especially scientists, and it's kind of a strange situation for scientists to suddenly be influencers and for everyone to be, not everyone, some people.
It's a new world, that's for sure.
It's very strange. And I hope it sticks around, fingers crossed, once we are past this pandemic. I hope that is maintained, because I think it's become pretty clear that our level of science literacy in this country is pretty low, which isn't anybody's individual fault. There's a lot of reasons for that, but this isn't the last time we're going to have a public health emergency ever. So it would be nice to have folks more prepared for it the next time around.
And now you did a poll though on your own Instagram and to kind of gauge vaccine hesitancy, and only 5% said when it was offered to them, they wouldn't get it. Do you think those who have questions are going to be seeking out science or medical influencers like yourself? Or do you think having that ongoing dialogue is why you saw that lower hesitancy level?
I've had, I don't know how many messages from people saying I was really hesitant and I'm not now because of what you posted. I've had nurses message me and say I wasn't going to get it, and now I am, and now I've gotten everybody else on my unit vaccinated. So that feels amazing, and that's reasonable to have questions, and I've put out an incredible amount of information and tried to answer every question anybody possibly could have, and that's totally reasonable, and it does change minds. And I'm a big believer that influencers with large followings are one thing, and we can make a big difference, but we also, every single person who's following us and listening to what we're saying is an influencer, whether it's on, social media or not, among their families and their friends and their workplaces. And I hear people saying, I didn't know how to talk about this with my family, and now from the stuff you posted, I know what to say and what to share with them, and now my mom and dad are getting vaccinated when they weren't going to before. And that's like incredible, Yeah.
Yeah, that's a great point. Everyone's their own mini influencer in a way. Are you seeing, we're now seeing more COVID cases though rising recently, and even as more people are getting vaccinated, are you worried that could have a negative impact on vaccination, or the opposite effect that, oh no, now I started to get used to maybe going out to restaurants and eating outdoors, and now cases are going up, I better rush and get a vaccine?
I don't know. I'm so curious to see how this all plays out. I'm nervous to see how this all plays out, because I do think there's a level of misunderstanding because the vaccines are all over the news. I think people think more people have been vaccinated than actually have. And I think we're somewhere 15-16% of the country has been fully vaccinated. And that's not enough for us all to just go back to normal life. It's really not. And no vaccine's 100% effective. So if you've got a 95% effective vaccine and you vaccinate millions and millions of people, just statistically, a few people are going to get COVID, even though they were vaccinated. But those cases hit the news and they're huge. And, so I do think, that misunderstanding could be dangerous. I don't know. We'll just see how it all plays out. I'm certainly out here just like
what's the message
screaming into the wind, trying to explain to people what's really going on. Yes.
Is that what it feels like?
Yes.
That you're screaming into the wind?
It feels like I just, I can't get this across to as many people as I want to, or people can't hear it, or I don't know.
Well, keep up the work that you're doing and keep us updated on what you're hearing, because it's a great insight into everybody on the ground for both the hospitals you work at and individual level.
Fingers crossed that we've all made some sort of dent in all of this. Yeah.
Well, thank you for your time.